Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in complex knee injuries. In this video, I'm going to explain to you what the LET or ALL reconstruction is in the setting of an ACL reconstruction or ACL injury. Over the last few years, there's been a lot of research into the development of techniques to help reconstruct the anterolateral ligament complex. This is a ligament complex on the outside of the knee that helps stabilize the knee and helps reduce ACL reconstruction failure rates. So in other words, it helps stabilize the knee during an ACL reconstruction surgery. There are basically two different types of procedures. One is called the anterolateral ligament reconstruction, in which a allograft or cadaveric tissue is typically used and to reconstruct the ligament on both the femoral and tibial sides on the outside of the knee. There are specific landmarks that the surgeon should be aware of and that are important in terms of reconstructing this ligament anatomically. The second technique is the modified Lemaire lateral extra-articular tenodesis, also known simply as an LET. In this procedure, a portion of the IT band is harvested. The distal attachment at Gerdy's tubercle, which is on the tibia, is left intact, and then the proximal portion is attached and rerouted to just posterior and proximal to the lateral epicondyle. As a patient, you don't need to know all the specifics in terms of the anatomy, but you should know that the procedure in itself, whether it's the LET or the ALL reconstruction, have both been found to help reduce failure rates in certain populations of patients undergoing ACL reconstruction surgery. So it's not a matter of whether one procedure is better than the other. They're both equivalent, but it's a matter of whether your surgeon feels comfortable doing the procedure and whether you would, as the patient, would benefit from it. Typically, there are a few different patient populations that have been proven to benefit from an LET or ALL reconstruction. These include our young cutting pivoting athletes, particularly those that are skeletally immature and with a soft tissue ACL reconstruction graft, as well as those with a hamstring autograft who are not necessarily skeletally immature. Also, patients who have demonstrated hyperlaxity or are very flexible patients would benefit from an ACL reconstruction augmented with an LET or ALL reconstruction. And lastly, patients who have had a prior ACL injury and are now undergoing an ACL revision reconstruction, those patients would benefit from an ALL or an LET reconstruction at the same time as their revision surgery. So an LET procedure in my hands adds a few extra minutes of surgical time, no special requirements during rehabilitation or after surgery, just an extra incision on the outside of the knee that's roughly about 3 centimeters in length, but it helps reduce failure rates of the ACL reconstruction surgery. And so in my patients, I am an advocate for this augmentation during the surgery, and I believe that in future years, as we teach more surgeons how to do this, that it will become the standard of care. If you're interested in hearing more about it, feel free to contact us or pay attention to some of our other videos on this topic. Thank you.